Today, we are going to talk about an incredibly complex and serious disease, prostate cancer. Globally, more than 1.5 million new cases of prostate cancer are diagnosed every year. This disease claims the lives of over 360,000 men worldwide annually. Since smoking has moved out of fashion, in our country, prostate cancer has steadily overtaken stomach cancer to hold a firm second place. Only lung cancer among smokers occurs more frequently. The prevalence of prostate cancer is influenced by age and ethnic background. It is also believed that dietary habits play a certain role. For instance, prostate cancer is most common among African American men living in the United States, whereas it is significantly rarer among Chinese men living in China. This clearly shows a link between genetic aspects and the environment, lifestyle, and even the air a person breathes. But we cannot afford to relax. This doesn't mean you aren't at risk. As a man gets older, the risk of developing this disease increases. Typically, prostate cancer develops in men over the age of 50, but cases at a younger age are also recorded in medical literature. In my previous video, I told you about a patient who was diagnosed with prostate cancer at just 37 years old. The undeniable link between prostate cancer and genetic predisposition has been proven. If someone in the family has had prostate cancer, the risk of developing it doubles. If two close relatives have been diagnosed, the risk rises 5 to 6 times. The prognosis for such a patient is often much worse than for a patient with no family history of cancer. Since we do not know the exact causes of this disease, all prevention measures come down to early diagnosis, detecting it in time to start treatment early. If you are a man over 40, you should undergo 3 specific examinations once a year. First, a PSA blood test, prostate-specific antigen. Second, a digital rectal exam, where a doctor manually checks the prostate. Third, an ultrasound of the prostate. I am often asked, what is the difference between a standard ultrasound and a TRUS? An abdominal ultrasound is when the sensor is placed on the lower abdomen to see what is happening in the pelvic area through the skin. A TRUS, transrectal ultrasound, is when the sensor is inserted into the rectum to examine the internal structure of the prostate. When patients ask, "Which one is better, doctor?" I always say, it is better not to be lazy and perform an abdominal ultrasound first. It provides a better overall view of the pelvic organs. It allows us to see the bladder and its walls, rule out stones and polyps, evaluate the seminal vesicles, and measure the volume of the prostate. However, for a detailed look at the individual elements inside the prostate, a transrectal study, TRUS, is superior. What is PSA? Today, PSA is the best tumor marker in our arsenal. These are proteins, fragments of prostate tissue, that enter the bloodstream when the prostate is damaged. This damage can be caused by either inflammation or a tumor. Therefore, an increase in PSA does not necessarily mean cancer. If the PSA is high, we must investigate further through manual examination and ultrasound. If we see signs of inflammation, we first prescribe anti-inflammatory therapy and active antibiotics, then recheck the PSA. Often, it returns to normal once the inflammation is cleared. In my practice, there were patients with PSA levels of 40 to 50 who were terrified, but after treatment, everything returned to normal and no cancer was found. If the PSA remains high after anti-inflammatory therapy, this is a reason to send the patient for an MRI. If the MRI shows a suspicious area that looks like oncology, it is a mandatory reason for a biopsy. A biopsy involves taking a small piece of prostate tissue for histological analysis to check if it is malignant or benign. A diagnosis of prostate cancer is only made based on a histological study. Even then, it is not a death sentence. Everything depends on many factors: the patient's age, the type of tumor, how far it has spread, and the presence of metastases. In some cases, we simply monitor the tumor. In other cases, various treatment options are used. I will not tell you about the treatment options in detail. I am doing this intentionally. I don't want you to go to an oncologist and demand a treatment you heard about on the internet. Choosing the right treatment strategy is the task of onco-urologists. The decision is made not by just one specialist, but by a medical board. A specific strategy is chosen for each individual case to avoid any errors. Today, we can treat prostate cancer. In some cases, it can be completely cured. Our ultimate goal is not to miss it in the early stages. Currently, we have surgical methods: open surgery, laparoscopy, or robotics, radiation therapy, hormonal therapy, and targeted therapy. The most important thing is to come at an early stage, and not when the oncologist has to say they can no longer help. I am often asked, what should I eat or how should I live to avoid cancer? Clinical guidelines state, at present there is no definitive data on the effectiveness of any specific prevention or diet in reducing the risk of prostate cancer. Because the cause is not fully understood, there is no 100% prevention. There are various theories about the frequency of sexual life, masturbation, infections, or the papillomavirus, but they have not yet been fully proven. The only reliable prevention is timely diagnosis. This disease has no unique symptoms of its own. Often, the signs are the same as those of prostatitis or an adenoma: difficulty urinating, discomfort, frequent trips to the bathroom at night, or the appearance of blood in the urine or semen. Many patients think that prostatitis develops first, then turns into an adenoma, and then into cancer. No, these are three separate diseases. They do not directly transform into one another. However, a tumor usually develops more often in an organ that is not perfectly healthy, or has previously suffered from chronic inflammation. Oncology should not be taken as a final verdict. Today, it is like a chronic illness. If detected early, it can be completely cured. If it is advanced, proper treatment can maximize the patient's life. The main mistake is when a patient does not believe the diagnosis and loses time running from doctor to doctor. Time does not work for the patient, it works for the disease. If you are over 40, come and get checked. Take care of yourself and stay healthy. Prostate cancer is not a death sentence, but it is a call to action. If you're over 40, don't wait for symptoms to show up. They often don't until it's late. A simple PSA test and an ultrasound are small steps that provide a lifetime of security. You're doing this for yourself, your family, and your future. If this video helped you, please hit the like button and subscribe to stay updated on your health. Share this with a friend or family member. It could truly save a life. I'm Dr. Narola, and my goal is to help you stay ahead of the curve. Have questions or want to share your story? Drop a comment below. Stay proactive, stay healthy, and I'll see you in the next one.